Hi, my name is Nick. I'm going to be your nurse today. I'm here to talk to you about your child's asthma. So we saw that you came in today. Your child had some shortness of breath and difficulty breathing. We drew an ABG, did a test x-ray, drew a few other labs, including a CBC and something called an IgE. So this lets us look at his O2 level in his blood and check for any issues in his lungs, as well as look at his the IgEs related to an allergic immune reaction. All of this has helped us to determine that we found your child has asthma. So asthma is basically acute attacks of airway constriction and restriction and possibly blockage with mucus, and this leads to like a high-pitched wheezing, chest tightness, fast breathing, tightness in your airway. There's different levels of classification for asthma based on the frequency and severity, so we will be sending you home with a few things so that we can get more information on that. This can be exacerbated by a lot of things. Typically, there's a little bit of a genetic factor involved, but also an allergic response to various types of allergens. So we need to have you fill out a sheet about some things in your home. Mold, dust, pollen are common ones, but also pet hair, chemicals, and other Vox, and a number of other things can cause asthma exacerbations. So we'll send this home with you so we can see if there are any allergens in the home. Exercise and exertion can actually make this worse. So it's important, if your child is going to be doing any heavy activity or sports, first we need to plan ahead and make sure you always have a rescue inhaler on you. The rescue inhaler that we're sending you home is a bronchodilator. You might have heard it, called albuterol. It's used to expand the airway in an acute asthma attack. We're also sending you home with a peak flow reader. This is going to allow you to check his peak flow at certain times, maybe if he's having a little bit of an exacerbation, and that'll be data that you can write down on this chart we're sending you home with. Lastly, there's a couple things you need to notify the provider on if they happen. If he ends up having if your child has a temperature over 100, pain in their chest, shortness of breath without coughing or exercise, just short of breath on daily activities, or uncontrollable coughing, you need to get a hold of us, and we can go from there. At this time, we're not going to prescribe him a long-term medication until we have more information and can classify his asthma, because this acute attack was not as severe as it could be, but we'll go forward from there too. If you have any questions, I've also given you our office's number, and we are here to answer any questions that come up. I hope you have a good day.